This is the initial management of acute decompensated heart failure. You first want to be able to recognize the clinical presentation of acute decompensated heart failure. Patients can have dyspnea, orthopnea, an S3 heart sound, jugular venous distension, which is what you see in the background here, lung crackles, and lower extremity edema. Some diagnostic studies that help are chest x-ray and getting a BNP. Then you want to evaluate the patient's clinical stability. If they have respiratory failure, you should immediately give supplemental oxygen, non-invasive positive pressure ventilation, and if those don't help, consider endotracheal intubation. If they're undergoing cardiogenic shock, you should give dobutamine or milrinone. Then you could focus on improving symptoms, which is mainly by reducing preload. IV diuretics and a venodilator help here. Diuretic like furosemide, venodilator like nitroglycerine. In some cases, you want to give a balanced vasodilator like nitroprusside if the afterload reduction is also needed. Lastly, you can spend some time to investigate the precipitating factors. You can do an EKG and troponin to assess for ischemia and arrhythmia, and you can do a bedside echo to look for valvular dysfunction.